Okay, I have 4 questions, and I'm going to try to roll them all into one big question, which is a bit of a challenge, but and this deals with abuse of the system. Many people are concerned about abuse of the system, and they want to know about safeguards. This one says, how can we be sure that the premiums for health care insurance don't get so expensive nobody can afford them except the very rich? And how about people who can't afford health care, the small business owner? Will there be assistance for them to make it equal? And will they make it equal for men and women? There's a stool for the panel to try to address. Anyone want to take a crack at it?
Why don't I start? All right. You know, through Health-RI, the organization that we helped build, we had 3 principles. One is you get everyone's premiums, all the dollars that are out there, and divided among the small business people and the unions and the state and the people who are paying out of their pocket, and try to move them into one place where we can all control where the money is so we can make some better decisions about the system. Second is we have to control costs. And we have to do it in ways that we haven't ever done before. Because that solves everyone's problem who has insurance and makes us more able to do the third thing, which is bring on everybody that doesn't have insurance. And what kinds of things aren't we doing that we should be doing to control costs? I think we need to be planning on what our system looks like, right? I mean, we need to understand that when you have 30 offices with MRIs in a state this small, you're going to get 30 times more MRIs than if you only had one MRI center in a state this size. We have to look at how we introduce that kind of technology to make sure it's available for people, to make sure it's affordable, and to make sure it's not misused. We need to make sure that in a state of only 1 million people, how many cardiac surgery units do we need? Do we need 2? Is that enough for everybody? Or do we need 5? And if the way we get to 5 is because every hospital sees it as a way to increase their bottom line, what does that have to do with healthcare? All right? So we have to look at planning, we have to look at distribution of services, we have to look at how doctors and nurses practice, and incentivize through the health insurance system the better ways of controlling costs. And we have to think differently and make some of those kinds of choices that we haven't been willing to make in the past.
Thank you, Doctor. This one. If a bill emerges from the Congress, passes a health care bill, I guess is what it means, what impact will there be on state budgets? Anyone want to take a crack at that one?
There'll be no impact because it's fully paid for. The governor mentioned that this would be questionable for the state budget, but it's fully paid for. I mean, I'll get people the information on it. It's covered. That's the benefit of the bill. If I can go back just a second to this previous question, if the insurance system was so good at reducing costs and incentivizing health care, why haven't they done it already? And the fact of the matter is, the only people who will be able to afford health insurance going forward are rich people. They're going to be the only people who can afford it. Now, with this bill, everybody's going to get health insurance. So if we give that to the market, the health insurers, we're giving them a captive audience. We're giving them everybody. So what are we going to ask for in return? Are we going to give them all these people and then let them charge whatever premiums they want and escalate health inflation forever? I should hope that you would count on us to be able to have some leverage to keep your premiums down and not have all these kind of direct-to-market advertising and charge you for all this bureaucracy. And then, by the way, they paid United Healthcare executive how many hundreds of millions of dollars the other year. And all of the executives, if you ever go out to Minnesota and see all those big homes, I mean, they've got hundreds and hundreds of executives earning hundreds and hundreds of thousands of dollars. I mean, you want to wonder how many denials of claims paid for all those bricks and mortars on those homes. So now people say, okay, well, if you're going to start, if you listen to Nick and say, oh, well, that sounds like you're starting to make big decisions on, you know, how much access we have because you're going to limit how many MRIs or this and that. That gets me nervous. I understand how that can get you nervous. But what also should get you nervous is the fact that there's not many years left in the Medicare trust fund. And we're going to need to make sure there's enough money in the out years to keep Medicare going. So people wonder, well, how are we going to, there's already rationing. How many of you can afford to pay for all your prescription drugs? How many of you can afford to pay for all of your doctor's visits? How many of you don't already worry about your children's ability to pay for your grandkids if they get sick? That's already rationing of care. How many of kids in this state can't afford to get their dental care paid for? How many seniors in this state can't afford to get their eye care paid for, or their podiatry? How many people can't afford to that? That's already rationing. So what we need to do is make sure we get to be able to afford to pay for the things that get us the most, as opposed to things right now where we're going to be running up against the wall. The responsible thing today is to prepare for the future so we don't hit that brick wall and then say people are going to start really getting hurt. Because when the cuts start coming down, we didn't do the right thing by trying to prepare in advance to make sure that it was softened and more people didn't get hurt in the process.
Thank you, Congressman. Anyone else? Okay, we have reached the witching hour, and you have been a wonderful audience. We have a fair amount of press here, and I don't want to see a headline that says AARP is asked to leave the Marriott. So I'm just going to ask our panelists to do a 1-minute wrap if they choose, and then I'm going to wrap up and hope that the people who have questions that were not answered will feel free to call us at AARP, and we will see what we can do to get an answer for you. And I think our phone numbers are all over the stuff you've got on the tables. I do have a question here, and I know it came from Bob Jackson. And I don't know how anybody as big as you are, Bob, can write in such very tiny print. But he did ask if the questions would be posted on the web, and I have to be honest and say we didn't think about recording for that purpose. So we'll see what we've got in the recordings and the video and make the decision based on quality then. Okay, panelists, a 1-minute wrap-up challenge for you. Doctor?
I'll go first. If legislation passes this year, it's not the end. It's really the beginning. And there is going to be a great deal of responsibility on people in this room and other Rhode Islanders to make sure that it gets instituted in Rhode Island in a way that really serves people. And certainly AARP and a lot of us hope to work together to make sure that it gets implemented in a fashion that it's supposed to.
Thank you.
All the questions that never were able to get asked or answered, I'm happy to get all of those and answer them. The ones that were needed to get fuller detail in terms of the budget and it costing the state or impacting the state, they may be interested in knowing some more about our global waiver and how that is going to get impacted in the year ahead. Not a question that was asked, but one that you would be interested in knowing. And in terms of the question on seniors being able to live independently at home, there is community choice, which is being able to have a waiver for Medicare and Medicaid so you can take those same dollars and be able to live independently. That's another piece of legislation I'm proud my dad sponsored when he was in the Senate that would be of interest to people, and we can get information on that to Kathy for your dissemination.
Thank you, Congressman.